As the saying goes, with age comes wisdom, but along with it, a change in appearance, from age spots and wrinkles to sagging features. Even your hands can't escape the ravages of Father Time.
I feel that my hands were looking like my mother's hands would look.
This is calcium, just like you have in your body.
Health Team 9's Dr. Linda McClintock is Medical Director of Ageless Medicine in Tampa. She says help is finally available.
Radius is essentially a new product that has crystallized microbeads of calcium suspended in a water-based gel.
For months, Dr. McClintock has been using it as a facial filler. Now, it has a different purpose.
We're using it in the hands to produce a youthful-like appearance. And in 10 minutes, we can take back about 20 years.
Good news to Monique Schaefer. As a hairdresser, work has been hard on her hands.
I was very surprised, yeah, I was. I didn't think there was nothing for hands.
And to 55-year-old Amy Edelstein, who says she didn't like what she saw when looking at her hands.
My mama, and she was 83, and I felt like I was 83. My hands looked that old.
Not anymore.
The benefits is immediate gratification of what the hand looks like, feels like, the texture.
After cleansing the injection site, the filler is mixed with a numbing agent. Dr. McClintock can tell by the appearance of the hand where to inject.
You're going to see a little asteroid form.
The calcium you see under the skin stimulates your own collagen production. With age, you lose collagen and skin begins to sag.
Wherever it looks like she's lost more volume, I want to get it there.
To do that, the gel is massaged into the hand.
It's funny how it doesn't hurt at all, even though...
As it's going in.
Yeah.
Immediately after the injection, the gel is still moldable, so the patient sits on her hand. The body weight provides good compression. Some intermittent icing, and the left hand is finished.
I'm going to look 29 again.
You are. They certainly are not going to be able to tell because of your hands what your age is any longer.
But not everyone is a good candidate.
If there is a patient that has severe rheumatoid arthritis or has diabetes or has some other kind of vascular issue going on with their hands, we probably are not going to be injecting this into their hands.
And for those it can help, Dr. McClintock responds to the critics, saying it's not superficial, it's about self-esteem.
People come in here with not feeling really good about themselves and walk out with a whole new attitude. They go on and they perform their job better, they have a better relationship with their spouse, with their friends, because they feel good from the inside.
For 42-year-old Kim Kitchen, it's improving the look of her skin that she's after.
What I see in my skin is just some discoloration, some brown spots, some areas that have redness, and also just looking to have some skin tightening I just noticed in the last year or two.
Lasers can do the trick, and thanks to the Trinity laser, it's one-stop shopping. The Trinity combines 3 different treatments in one session, and no needles.
It's really non-invasive. You know, there's no injections, there's no cutting, and yet you're going to have results.
Results like color correction, firming, and wrinkle reduction.
Any of the 3 sections that we're working on, I can actually do more of one or another and really make it unique to the person.
Advanced registered nurse practitioner Kathy Corbo is an international laser instructor.
The trend in laser therapy now is to have one base that provides energy for the laser, and one can either change lenses, or in this case we can change applicators depending on the purpose that we want to see change in the skin.
Corbo gets started with color correction, targeting brown spots on Kim's neck.
I'm just setting the parameters now that are going to be most effective and safe for her skin type. Just going to put some gel right in the area where we have the spotting. Okay, now you're going to feel a little sensation, a little heat, a little tingling sensation.
In a few weeks, the cells will float to the surface and flake off.
The end of the applicator that I'm going to be using, Kim, actually has a cooling or chilling tip.
Corbo changes her laser and the firming treatment gets underway.
You're going to feel a little pressure and coolness for a moment. Now I'm going to discharge the laser. And in order to heat that tissue so that we can stimulate the cells that make collagen so that they firm things up, I'm going to go over and over the area.
With half the face finished, Corbo shows Kim the immediate difference.
This side of her neck looks a little bit tighter in the jawline. On this side you can see where it looks a little more lax. So this cheekbone here looks more rounded. This line is softer. This is more lifted here. than it is on that side.
After finishing the firming treatment, Corbeau arms herself with a third laser to erase some wrinkles.
And what I'm going to do is I'm going to specifically go right along the wrinkle line. You're going to feel heat and kind of a very distinct tingling sensation over the wrinkle line.
A few more passes.
It's much smoother through here.
The redness will last about 30 minutes. The lines will start to swell, then eventually soften. As with any laser treatment, there are risks.
We always run the risk of possible little redness or a little blister that might form. Most of these things are very easily remedied.
But she says the benefits can create quite a boost.
We know that to have something running effectively and efficiently, whether it's our automobile or whether it's our body and our person, socially and professionally, we need to maintain ourselves as best we can.